Our senses are a very important part of the way we live. They are our physiological method of perception. Vision is, without a doubt, the most important sense in the human body because it allows individuals to directly assimilate information from the environment, both immediate and distant. Unfortunately, most people don't think about how precious their sight really is until it becomes impacted.
Glaucoma is an eye disease that results in loss of vision. It's a gradual damage to the nerves that carry the visual images to the brain.
Glaucoma is serious. It's not a disease that you can take lightly. It's the second leading cause of blindness in whites and the leading cause of blindness among African Americans, Latinos, and Hispanics.
In the U.S., roughly 4 million people have glaucoma. Worldwide, it's close to 70 million. And these numbers are increasing because it is an age-related disease.
The vast majority of clinical studies have shown that early detection and immediate treatment are critical to preserve eyesight.
Glaucoma can result in vision loss for two primary reasons. One, it isn't diagnosed. And if it isn't diagnosed, it won't be treated. And so that can result in gradual loss of vision until there's enough vision loss that the person actually realizes it. The other reason is not following the doctor's directions in terms of using medications.
Unfortunately, medications have severe compliance issues and detrimental side effects to many patients.
We have to rely upon the patient telling us that they're taking their medicines. The problem is that patients, even patients who want to comply, sometimes forget. And it's very painful to see somebody who comes in after years of non-adherence, having lost vision, and then comes to us and says, what can you do? And there's not much you can do. One of the things we have to do as physicians is be aware of non-adherence, questions patients, look at monitoring systems, have patients keep diaries. Rather than force people who are not going to be adherent, we should then look to other means of therapies that can obviate the need for taking drops all the time.
With chronic drop therapy, it's been demonstrated very nicely that it can create irritation on the front surface of the eye. Using the drop every day, whether it be the drop or the preservative that's in the drop, chronically seems to induce irritation on the front surface of the eye, and this can lead to either a red eye or an irritated eye, as well as subsequent vision loss or visual degradation. And so if we can reduce, or in some cases eliminate drop therapy, we can surely improve the comfort and vision of patients.
As science and technology continue to advance, so have treatment options.
Laser technology is absolutely ideal for various eye procedures. Thanks to the optical properties of the human eye and by utilizing different lenses and mirrors, we're able to accurately direct the laser beam to specific areas or tissues within the eye in a non-invasive manner. Furthermore, lasers allow us to specifically target different chromophores within the eye by using different wavelengths. And wavelength is a fancy name for a bandwidth of electromagnetic radiation that we humans perceive as colors. So by selectively targeting those chromophores, we are able to induce a biological response from that tissue and improve the overall health of that tissue.
Lumenis Vision has been the preferred partner in laser therapy since they introduced the first laser photocoagulator to ophthalmology in 1970.
And since then, we've pioneered more than 5 major product platforms that have all gone on to become industry gold standards. What has motivated my colleagues and I today is the desire to provide ophthalmologist tools that improve the patient's quality of life.
Just over 20 years later, the Lumenis SLT was developed by Dr. Mark A. Latina as an alternative to thermal laser trabeculoplasty.
The most potent medication are called prostaglandin analogs. And there are 3 kinds of medications of that type. And what we have found is that those medications work exactly the same way as the laser procedure.
The benefits of selective laser trabeculoplasty to both patients and providers are numerous. From a provider standpoint, I think the most important thing is a very safe nature of a procedure, and that's what this gives us to manage people's eye pressure. For patients that are on 2, 3, and in some cases 4 bottles of medicine a day, this might reduce the costs of using medical therapy. it might improve the quality of life by not having this arduous regimen of medicines to take. And finally, it might actually improve their vision and comfort of the eye by reducing the number of medications that they have to apply on a daily basis.
Lumenis SLT assures 24-hour intraocular pressure control without a challenging routine or schedule. As well, there are no demanding side effects. It is less expensive than medications and allows for intraocular pressure control equivalent to top prescribed medications.
It takes somewhere between 3 and 5 minutes to perform the laser. Prior to the laser, we'll put some topical anesthetic drops in to numb the eye. There's no needles. The laser is just a light beam, so there's no cutting done during the procedure. We do put a small lens on the patient's eye, on the front surface of the eye, to focus the light, and somewhere between 50 and 100 applications, depending on the scenario, are performed. Afterwards, the lens is removed and the patient can immediately resume their regular activity and, again, immediate recovery of their baseline vision after the procedure.
Patients afflicted with glaucoma and treated with Lumenis SLT have all experienced an increase in the overall quality of their life, while the patients, payers, and payees have all realized healthcare savings.
Glaucoma compliance is similar to a game of chance. Lumenis SLT removes the dependency of external factors, providing 24-hour intraocular pressure control at a less expensive price than medications that would otherwise be taken, providing patients with a significantly better quality of life. For more information on glaucoma, please visit glaucomaslt.com.